plants that I put out here to make it look kind of nice when I put in right at the start of all this.
Are you in any danger, Chuck? We need to know that right away, do you think?
It's hard to say at this point. They can be aggressive.
What you need is my dog to chase them. You wouldn't have any squirrel problem.
I have a dog right next to me who will do nothing about this. And then I have another dog upstairs who is too small to really do anything. So.
Yeah, I'm just thinking about taking your concentration away, like I'm focused here, squirrel.
Yeah, that's what I worry about is that's what it looks like. So, okay, I think we are all set. I think everybody is here, so we will go ahead and get going. So again, welcome to our weekly news conference on all things COVID here in Bloomington, Monroe County, also with IU Health and Indiana University. I am Director of Media Relations for Indiana University, Chuck Carney, and as always, we will have Mayor John Hamilton of Bloomington here with us, Monroe County Commissioners President Julie Thomas, IU Health Program Director and Community Relations and Outreach, Shauna Gerges, Monroe County Health Department Administrator Penny Caudle, Monroe County Emergency Management Director Allison Moore, and IU's Assistant Vice President for Strategic Partnerships and the IUB COVID Response Unit Lead, Kirk White. So let's start off today. First of all, let's go with the Health Department for a quick update, and then we'll go to the mayor.
Great, thank you, Chuck, and thanks for everybody being here. We have big news, is this partnership, and we have worked together all year long, and specifically around COVID-19. And this week we are pleased to be able to announce our partnership to bring a community COVID-19 testing site that will be up and running later this month. We hope by the end of the month, and then it will run through June. So we did send out a press release about that yesterday, just a joint release from all of us. It is a joint effort, not only between the health department and the county, but between the city, Indiana University Health, Indiana University, and it would not be happening if it was not for this partnership. The state has came to the local health departments late this summer to offer what really was very small seed money for testing, for a community testing site. And a lot of counties did not do it because it wasn't enough to really cover the costs. And when we brought that to the commissioners and to this group, the commissioners were in right away, and this group was, we need to pursue this. Even if it doesn't work out, we really need to pursue it and make it happen if at all possible. And so we're pleased today to be able to say that those agreements and the details are being worked out, and we are moving forward to bring that testing site. The Optum site, which people have been used to having, we're thrilled to have that here. The state contracted early on with Optum to have sites around the state, and those are on a month-to-month basis. So currently it is scheduled to be here through October. We do not know if it will be renewed for November or not. The state lets us know when they make those decisions. They have indicated that at some point this year, they will not be using all of the sites. I think they have like 92. I've lost track now of how many they have, not one in every county, but they have a large number of those sites, and they will start closing some of them. My understanding is that some of those Optum sites will remain in the state. Certainly places that don't have other options, they'll want to make sure that there's testing availability. So I don't know how long the Optum site here will remain open, at least through October, but I don't know how much longer after that. And we wanted to ensure that testing was available. So again, I can't thank all of our partners enough. IU Health Hospital has been very, very generous in helping us with space and accommodations, and the city and the university have stepped up to contribute financially as well, and that's going to make this happen. So we don't have all the specifics in terms of hours of operation and those kinds of things. That will be coming once we have the site ready, and it will include online registration, much like Optum is. And it will operate about 35 hours a week. We'll have some evening and some weekend hours. So it will not be open quite as much as the Optum site, but we do anticipate doing at least 200 tests a day when they are open. And so we're excited to bring that opportunity to the community. So there are some other things that I might share just in terms of our local numbers, and another reason that we want to keep testing going. You know, that's part of all of the mitigation and the work to contain and try to slow the transmission of COVID-19 is all of the things that we're doing together. So we know that we need to continue to wear masks, to physically distance, to wash our hands, to stay home when we're sick, all of those things. But we also know that testing availability is important so that we can identify when people are sick and they can be isolated, or if they're close contact, they can quarantine. And that's how we will spread or reduce the spread of this infection. Testing is not prevention. And so it takes both of those things for us to really get control. So I mentioned Wednesday at the commissioners meeting, there's a new acronym out there. And but I'm going to say we have a new weapon too, and we can smash COVID-19 if we work together. So that acronym is S for social distancing, keeping that 6 feet between us whenever possible, continuing to wear our masks or face coverings when we can't maintain that social distance, when we're out in public and around other people outside of our household, avoiding crowds. We know that when we are in crowds, that we have the potential for infection and transmission is greater. So avoiding crowds, again, especially with people that you don't know, you want to be masked, you want to maintain that distance. Staying home when you're ill. And when we talk about being ill with COVID, it's symptomatic or not. If you've had a positive test, you are ill. So stay home, stay away from others. And if you're a close contact, then we need you to stay at home and quarantine and, you know, follow CDC guidelines. And the H is hand washing. Continue hand washing. We are entering into flu season. All of these things can help us keep the spread of influenza down and other respiratory viruses. So we need to do everything we can to get as little transmission of anything right now. Again, fall breaks, holiday travel is coming up, so we need to remain vigilant and just do everything we can to reduce our risks of transmitting the infection if we get it, and prevent ourselves from getting infected if we can. Back to you, Chuck.
Okay. Well, with that news of the upcoming clinic and that partnership between the city and everybody here on this call, go to Mayor Hamilton to talk about that and other things.
Thanks very much, and nice to be with you all again. Thanks for everybody tuning in and paying attention to this, for all the good work that's happening locally. I think I want to start today just briefly noting that our state is not really doing well, and I'm greatly concerned by some of the signals, of course, that we see at the national level, and concerned about our president and hope he gets well, but also the signaling about nothing to fear, don't fear, and continued mixed and I think very inappropriate signals about this disease. As I look at the state's website, just checking it today, the 7-day moving average of positive cases is up 50% in Indiana in the last month. Saying that again, the 7-day moving average of how many positive cases we're seeing each day in the state of Indiana has gone up 50% in the past month at its highest level ever, according to the state website. It's been rising since the governor announced his planned changes, including eliminating the mask mandate and other loosening of restrictions. Deaths remain low, which is a very good, positive, ultimate indicator, very important, but it's just, in my view, really the wrong signal, the wrong decisions about changing direction in the state with that kind of underlying data. We know there's some real eruptions in some of our neighbors as well. We just shouldn't be loosening our rules yet, in my view. We should retain the mask mandate. And of course, we will, I hope, and plan to, in the short run at least, locally, and the governor does continue to acknowledge the importance of that. But I just want to note, there's this disconnect between some of these underlying signals that we see in the data and the steps being taken. And I just think it's encouraging and reminding us locally how we need to stay the course because, again, very significant. I use, of course, the source of the vast majority of testing, and that continues for the fourth week in a row to show positive direction, which is encouraging us that even with the challenges that were particular to our community over the last couple months, that we're seeing positive direction, and that's really important, really good. It just encourages me to keep staying the course that we're doing and encouraging all of us to know that these early steps we took, masking, tighter restrictions on social gatherings, smashing COVID, I love that, that's great, Penny. Thank you for that, including the crowds and including that, to continue that effort. I will just also add briefly, yes, we're really glad to be a full partner in the clinic. That's a terrific asset for the community and a reflection of the great collaboration that we've had going all this year among all the parties here. The City of Bloomington Utilities did share with the health SWAT team, if you will, the health task force on Wednesday, the briefing on the data of their testing, as I mentioned last week. That will not be public until that scientific study, if you will, is completed. But they did share that with the health experts this week, showing some indication that we may be able to see infection blooms earlier in sewer data than otherwise. But so far, the data that we've been able to see from the sewer testing, which is going on each week, has really confirmed the same data, reflective of and accurate with all the other data sources that we have. So there's that. And we'll continue to monitor that weekly and report it regularly to the health experts and then ultimately to the public as soon as we can. The city is also continuing the rapid response funding program. It's now approaching $2 million that has gone out the door to support local businesses and nonprofits as they're dealing with this. We sure hope things continue to turn around. The city is also continuing our protocols in the workplace in moving forward without any expected changes in the short run. We did have a first report of a police department employee who tested positive. They are doing well. That's the 11th employee of the city, plus 2 more at transit in this period. We'll continue to report those, and glad to know that all have recovered to date. And I'll be happy to take questions. Chuck, back to you.
Okay, let's go to County Commissioners President Julie Thomas.
Hi, everyone. Thanks for being here today, as every week, and thank you, Chuck, for moderating our discussions. Yes, we're very excited. The Board of Commissioners is very excited about this collaborative effort to ensure that we have testing through 2021. And we appreciate the contributions of every single partner in this. A lot of work has gone into it, and we cannot thank folks enough. Our health department, IU Bloomington Hospital, IU in the city, thanks to everyone for making this possible. It's really amazing to see that amidst a crisis like this, our community can really build strong connections and utilize those to benefit everyone. So just a couple quick notes. We still encourage folks in the, I believe it's falling on me. We encourage folks who are in the community. Every county resident lives in a township. If you need assistance to pay for your shelter, food, utilities, please contact your township trustee. We have provided, Monroe County's provided additional funding to support our trustees to ensure that we limit the impact of evictions and utility disconnections on our residents. As for businesses, following up with nearly $400,000 in grants to county businesses and social service agencies, we are continuing to provide CARES funding for any business in the county or any social service organization that needs funding to cover costs, additional costs due to COVID. These can't be payroll costs, but others are welcome to apply. And as of yesterday, our numbers are $143,670. And that's a grant to those businesses. And we've also granted over $36,000 to local taxing units, mainly the Monroe County Public Library. Also a quick note, it looked like folks who began early voting, which started on Tuesday this week, that early voters were wearing their face shields, face coverings, or both. And it was really great to see that. Very busy turnout. But just a reminder that you can vote in person early at 401 West 7th Street, which is the Election Central office. If you do qualify to receive a ballot by mail, you must request it by October 22nd. Unfortunately, voter registration is closed at this time. If you need any further information, you can go to indianavoters.com or monroecountyvoters.us and find that additional information. But just a good reminder to everyone to keep an eye on one another, our neighbors, and please keep wearing your face coverings to protect our community, to ensure that we're in great shape once this pandemic is over. And with that, we'll take any questions. Thank you so much.
And I can report that people were wearing their masks this morning. You get this handy sticker if you go to vote. My whole family did it this morning, and it was running very well. Let's go to Allison Moore next.
Thank you, Chuck. I have a couple announcements to make. We have 2 blood drives scheduled for October, a daytime and an evening. This is a repeated announcement, but the more I announce, the more people hopefully will get signed up for our blood drives. The first one is scheduled for October 22nd, and it is during the daytime of 10 to 3. And the second is scheduled for October 28th for the evening time slots of between 2 and 7. You can register at redcross.org, and those date and times are on our county website. And then I'd also like to mention that last week, Ms. Cottle announced that we were encouraging people that are participating in Halloween activities to follow the CDC guidelines. And so that information is on our county homepage. There is a direct link to the CDC holidays, and so you can find not only Halloween, but those other holidays that are going to be following. And but specifically, this announcement's for Halloween. We do have several safe places in the community that are willing to hand out candy, and we have a list of some of those places, and most of those are fire stations that are willing to hand out candy for us, that have been made aware of the CDC guidelines and will be following those. And so if you want to participate in Halloween trick-or-treating and want to go to places that you are assured are going to be following CDC guidelines, you can check that list out on the county homepage. And I will put that in the chat. It is co.monroe.in.us. That's all I have, Chuck. Thank you so much.
Okay, let's next go to IU Health and Shauna Gerges.
Hi, Chuck. It's great to see you today and everyone on the call. Just a few updates from IU Health. First of all, while the number of COVID positive inpatients that we have seen within Monroe County continues to be low, which you can see from these charts, we have seen an increase in COVID positive inpatients this week in Lawrence County. So this is a concern. In addition, within the IU Health system, our hospitals in both Muncie and in Lafayette have experienced high volumes of COVID-19 inpatients as well. So that's just a reminder, just as Penny had mentioned, that for those with current and upcoming fall break plans, please keep in mind that the risk of the spread of COVID-19 is still very real. And while treatments continue to evolve and improve, it is still critical that we are diligent and wear a mask and practice physical distancing, because you care about your community and your loved ones, and we want to keep them safe. We do want to just mention that we apologize for the delay of the release of our IU Health COVID weekly data that is sent to the media and the public each Monday. But this week we experienced a technical glitch that delayed that, and everyone received it on Wednesday. But you can see from this slide some of the key indicators and where we're at as a region. Want to just talk about flu shots for a second. The Monroe County Public Health Clinic, which is a collaboration between IU Health, Bloomington Hospital, and the Monroe County Health Department, is offering flu vaccines to people of all ages. Limited high-dose flu vaccines are also going to be offered. You can call 812-353-3244 to make an appointment. This week, as you can see from this slide, our flu shot clinics will be offered in 4 different locations across the region. The flu shot clinics are free of charge to the public, and no appointments are necessary. So again, check out the locations and times of those as well. And just as a note on that, IU Health Bloomington and our community health team have vaccinated 11,800 people and will be completing 50,000 vaccinations over the next few months. So just one more reminder to make sure you get your flu shot. And then lastly, as several of my colleagues have mentioned on the call, we just want to thank all of our community leaders that are participating today for their tireless work that putting into protecting our community over the last 7 months, and the continued diligence and guidance for preventing the spread of this virus. To date, the OptumServe site at the Armory has completed approximately 21,000 COVID tests, and IU Health has completed over 24,000 here in Bloomington. By us working together, we will continue to have a greater impact on the communities that we serve. So we are very proud to support the new COVID testing site and appreciate all the great work that our community continues to do in keeping all of our residents safe. So thank you to everyone. And
Okay.
back to you, Chuck.
Thanks, Shauna. Let's go to Kirk White. Kirk, another good week of results.
Yes, good afternoon, everybody. Yes, on all of our metrics, as the mayor mentioned earlier, all of our metrics showed a continued downward trend for the 4th week in a row. And I think this just lays evidence to what Penny and others have talked about, the importance of why we keep this messaging up and not get complacent about what has gotten us to this point. And that is being in one of the best spots any place and on a university campus. Just quickly, I think folks have seen the numbers, but in RPS and our residence halls, we went from 1.5 down to 1.2%. Greek housing went from 2.1 to 1.6, and off campus 0.9 to 0.5. And so that's really good numbers. And I think good evidence of this is a study that was done this past week was released from our colleagues over at Davidson College. The College Crisis Initiative over at Davidson College published a report that noted that only 25% of universities with over 5,000 undergraduates are doing mitigation screening. Only 25%. And further, only 6% are doing the mitigation screening routinely for all students. So that means that Indiana University is at 6% of the universities across the country with over 5,000 students that are doing this. So that's what's kept us to this point, and I hope we'll continue to. And we're doubling our efforts, as I mentioned last week. We expect our new labs in Bloomington to be up and running in a couple of weeks, and we'll be able to double at least our testing, which should get us up to 20,000 tests a week. And again, this just continues to help us find where there are infection and get it quarantined and isolated. So we switch over to flu. That's a new major initiative for us, much bigger than we've ever done before. And flu testing today has started. I'll put the link in there if you want to take a look and see some information. The IU community, students, faculty, and staff can log on to the link from this site that I just listed. You'll need your IUID login, and you can find an appointment for our flu clinics. They'll be out at Simon Scott Assembly Hall. They started today, the clinic did, this mass immunization effort, and we expect to be able to immunize 1,000 people a day. It was right at 1,000 had made reservations already. This will continue tomorrow, and then the next date that's up on the calendar is the 17th. So we're looking at Fridays, Saturdays, more or less. So I'd encourage everybody in the university community to make that appointment or do it in the private sector, either one. Just get her done so we can be immunized against flu and knock a lot of this confusion down between flu and COVID and a head cold and that sort of thing. So that's where we are. Looking good this week. Thank you.
Okay. Well, we will go ahead and move into questions. We have quite a few already. First of all, from the B Square Beacon for Mayor Hamilton about the $100,000 that the city is contributing to the new testing center. Where is that money coming from? Is it from the mayor's office, Public Works, ESD, or somewhere else? And will that need an additional appropriation to be approved by the city council?
Thanks for the question. The money is going to come from the Federal CARES Act appropriation, which is basically a reimbursement process. And like many of the CARES Act expenditures, we certainly keep the council informed. And I actually don't know exactly whether the council will vote on that. We know they're a full partner and we'll be collaborating with it. But it's essentially federal CARES Act funding that is made available through the state to the local governments to help support responses to COVID.
That was essentially Emily Ernsberger from the HT's question as well. But following up on that for Kirk, does the university's $100,000 need approval from the trustees?
I don't believe so. I think that money will come from campus operating expenses that we have allocated already as part of the campus budget. And of course, as the mayor mentioned, we're trying to keep track and are keeping track quite a ledger of expenses for COVID mitigation. And as state or federal reimbursement funding would become available, we'll be applying for that. We don't know where that might be, but at this point, this investment for us in the community is just part of the partnership that we value with the city and the county. And as you can see, I noticed in today's Herald Times, for example, Emily, that good reporting about the age groups that are taking advantage of the test site at the Optum site. And you can see that 20 to 30 age group is taking good advantage of that. And so this is another reason why the university thinks it's a good investment for our funds.
Go ahead, Julie. Sorry.
Yeah, I just wanted to add that the county is also putting in $100,000 from what will be CARES funding. But as an FYI, we're also going to be submitting this for reimbursement through FEMA. And if that reimbursement happens, we will go ahead and reimburse IU and the city what FEMA reimburses us for. So we're still pursuing other options, but we wanted to ensure that this project could proceed. So we do appreciate everybody's willingness to support it. Thank you.
We appreciate you submitting to FEMA. That's nice. Thank you. I just wanted to say too, it's a reminder, incredibly frustrating that the federal government seems stuck and sitting on its hands, particularly administration, not continuing to support more response money for including local governments and state institutions of higher learning to help continue this response, which is ongoing and is going to keep having demands on us for quite some time. Thanks.
Question for Penny from Emily Ernsberger at the HT. Will people be hired to conduct tests at the site? And is that some of IU's in-kind support?
As you know, the biggest budget for almost anything is personnel. And that's one of the biggest costs there is. We'll be using an agency to, much like Optum does, to provide the staffing.
Follow-up question here from Ethan Burks from WFIU, WTIU, and I think this is still an open question. Where will the new testing site be located? And he also asks, will it offer rapid testing?
Right now, it will not offer rapid testing. That's not part of the grant agreement. The state will be providing the tests and the couriers and the labs fees for that. It is downtown. It's in a convenient location, walk, drive, off the beeline. But it's not a secret. But the space is not open yet. And so we would just say, wait, when we can announce exactly where and when and how to register, but it is downtown and convenient.
With parking.
Yes, with parking.
So this is for Penny and Mayor Hamilton. With the record number of COVID-19 cases statewide this week, what would you like to see from the state government on restrictions? Do you think local health departments and government bodies can handle making these decisions on their own?
Well, from a local health department standpoint, I think one of the things that we have seen in communities, not just ours, but the state, early on is that the mask requirements has made a big difference. And when people wear them and they maintain that distance, they have those things in place. We've got smaller gathering size limits than the state does. Those are all things that I think will help us move forward in a better way. The Board of Health met last night. They are not changing any of our local regulations at this time. So we still have the same gathering size limits. We still have all of those same things in place, and we'll keep them. So even if Indiana were to remove the mask mandate after the 17th of this month, it would still be in place locally. I would hope that that will stay in place for a period of time until we are clear that we're in a much better place for a continued period of time. And as we've already heard on here from several of us, we're coming into flu season, and that makes it a lot scarier in terms of how do we don't know, right? Last year, this really started, we were kind of on that back end of flu season. And so we know that we had a hard way to go in the spring when we were in flu season, and we're just starting flu season. So that's why it's important to vaccinate, keep these things going. I know it's difficult. I think we would all love to be able to say that I don't have to wear my mask anymore. I don't have to worry about how close I'm standing to you. But the reality is we do. And the more that we pay attention to those things, the better we will be at getting through this and, people not being hospitalized and people not dying.
Thank you. I would just add, look, with two things right in front of us. One is, as Penny Cottle just said, the flu season arriving in serious measure. And two, the very significant data of statewide cases. I just do not believe it's responsible for the state to loosen restrictions in the face of both of those things. I think we tried locally. We focused with the health experts having focused on the mask requirement, which we know helps, and the super spreader event restrictions by gathering sizes. Those two simple things seem to be helping. And for the state to move away from that is just not responsible. Look, local governments, including ours and all across the state, people are working their tails off and doing as best we can. And we have an amazing talent and capabilities here in Monroe County with the university and IU Health adding to the health department and governments, but that's not typical across the state. At the national level, we should have had a national mask mandate long ago, and it should be, these mask mandates and restricting super spreader events are, the cost of them is not that high. The benefits of them seem to be very significant. And the fact that the state is moving in the opposite direction in the face of flu season and significantly rising positive cases just doesn't make sense to me. The governor has said, well, it's different around the state, so different locales can do what they think is right, which is good that he has said that, but we don't all have this expertise, and it really should be a statewide control. It really should be more national controls. And the fact that the United States has had more deaths per capita than any developed country in the world shows we haven't managed this well, and it's dependent upon local governments to step up with local health officials and partners, which we have, but it shouldn't be laid at our laps. And I'm sorry that the state is moving in what I think is the wrong direction at this time.
So Penny, I am slow on the uptake sometimes, and so I think I missed the acronym the first time. We got a question about it. So the acronym, as I understand it, is SMASH. Can you explain that again?
And it is SMASH, it's social distancing, so that we kind of like the term physical distancing better, but social distancing, 6 feet. So maintaining that 6 feet. The M is for masks, continuing to wear your masks. The A is for avoiding crowds. As the mayor said, those super spreader events, right? But any kind of crowd that might put you at risk. And S is for staying at home when you are ill. And the H is for hand washing.
Okay.
Hey, Penny, who's the author of that again?
It was not me. It came from the state, so I cannot take credit for it. I do not know who came up with it, but the state shared it and I have passed it on.
Great, thanks.
So, yeah, and Mayor Hamilton suggests that S for 6 feet is an alternative construction, or just say
there you
PMASH if you want physical distancing at the start of it. So I'm happy to take more questions if we have some. Still have a few minutes here, so I will do my vamp here for a moment as I watch for questions to come in. I'm sure that we will get one or two here. Kirk, we are getting questions, you and I, all the time about spring semester. At this moment, fair to say that the spring semester will look much like the fall semester does right now as far as the things that we have in place.
Yes, that's right. In fact, we will have some type of arrival testing again as we get back to February 7th, when we'll have some of the in-person class, or the classes that have an in-person component. That will start February 7th. And so we're going to do some level of arrival testing, but we're working out the plan for that at the moment. And again, I'd remind everybody that we don't have fall break and we don't have spring break. We'll end the in-person segment for fall semester right the week before Thanksgiving, and there will be no in-person instruction until February 7th. So again, there's that intersession, the winter session that's new this year, and we're encouraging our students to sign up for classes, to consider which ones they could take to continue their academic progress. The good part about that is that the fees for those classes for the winter intersession are going to be included in your fall or spring semester package, so there's no additional cost. This is a way we want to keep people on track, because we know that there are a lot of disruptions during this period, but we want to continue to maintain good academic progress and keep people's brains moving during the holidays. So, and we're going to continue to discuss with our students safe practices while they're away, to keep that in top of their mind, that Just because you're not on campus doesn't mean all the rules are off. Go ahead and practice those things you've learned while you're on campus that have kept us safe so far, and spread it around, those safe practices, to wherever your home is.
Yeah, Mayor Hamilton.
Chuck, I was just going to add, and kind of circling back a little bit about the state question. You know, every county of the 92 counties in Indiana has county commissioners. I guess Marion County is a little different with that, but most have cities with leadership, and all have a county health department. Noting again that our county health departments are the lowest funded per capita in the country, so they're doing incredible things, and you know, all the government entities are working hard. I think it's important to note, and worth noting, that here in our community we have two extraordinary partners with Indiana University and Indiana University Health. That is not typical in most counties, to have that kind of resource, and the commitment that they've made, the energy that they have put into helping respond over the last 7 months to this is just extraordinary and unusual. It's been a big part of why this community has been able to handle a lot of complicated challenges so far so well. And I just want officially and publicly to acknowledge, of course, the governmental entities work together as we always do well in coordinating responses to this, from emergency management to health, the commissioners, council, city council, county council, mayor's office. But these two extraordinary partners have been really important, and they've been essential to help us show the curve that we've been able to show. And I want to thank them both for all their leadership and partnership in this. Thanks.
Well, we are most definitely in this together, for sure. Well, seeing no other questions, we'll go ahead and wrap it up there. We will return again next week at noon on Friday to talk about the latest in the effort against the pandemic. So thanks for everybody for joining us.
Thank you, Chuck. Thanks all.